The clock is ticking. This is benefit season, and Medicare enrollment closes December 7th. Ignoring the deadline and not analyzing your current health situation can cost you thousands of dollars. Danielle DeChico from RBF Retirement Solutions is here with more details on the ever-confusing Medicare drug plans and one of the more expensive aspects if you don't do something.
Correct.
So help us understand, and I know Linda has been through this and with you now as well. How do those different drug plans work? Where do you even start?
Well, unfortunately, Medicare wants you to try to figure that out on your own. And doing this for as many years as we have, it's still difficult every year. 2 years ago, there were 28 drug plans. This year, there's only 22 in 2024. So, you know, if yours went away and they didn't tell you, you could be spending a lot more money because they'll just put you in whatever next plan they have for that particular pharmaceutical company. So by getting somebody to look at that for you and going through all the options for that current year is very, very important, because you could not imagine how much money you can save just by changing pharmacies.
Oh, yeah. You know what? I've been on Medicare for 20 years. I thought, okay, I'm not stupid. I've got this. But I would like to have a checkup. So I went down to her office. Within 15 minutes, I'd saved $1,000 for the year.
Yeah.
I look back at all the years I didn't know about that. Tell us how you did that.
Basically, it's just years of understanding how Medicare works and how the drug plans work, because if you are on one drug plan one year and you want to stay on it for the next year, it doesn't mean that that contract with the pharmacy that you go to is going to be the same next year. So we'll have people say, oh, you know, I really like XYZ pharmacy down the street. I said, well, that's great, you know, but they're more expensive on your plan this year. Go there to buy other things from them. But if you want to save several $100s a year on your drugs this year, I suggest you go over here.
And you wouldn't know that if you didn't have the plan analyzed. That's the
right.
takeaway I can't get over.
They're good pharmacies. There's nothing wrong with them. The plan just chooses certain pharmacies they use, and you got to go along with those.
And they don't make it real evident, I'm guessing.
No.
Okay. So you take a look at the current coverage people have and kind of compare it to their needs. Is that correct?
Compare it to the plans that change, because they're going to change every year. So I'm looking from, even if you didn't have a medication change from 23 to 24, that doesn't mean that your plan is not going to be as beneficial.
Got it.
Because it can be a different plan we're going to put you on with a lower premium, and I'm going to send you to a different drugstore because you're going to save so much more money by doing that. So it's really, it's a little game that we play, unfortunately, in order to you know, really not waste any of our money.
Well, and that's a good game, right? We want to play games to save money. So that is definitely something.
It's a lot of money. It's not, I was thinking, oh, we're talking about a few dollars. It was big dollars. So it makes a big difference to me. And you just hate throwing away that money.
I know. We talked about that. New clothes and stuff.
I was just going to say, Linda's off to shop with that $1,000, but as well you should, because nobody wants to give it away. Now, when we analyze, say, an Advantage plan versus a supplement, can you move interchangeably between those? I feel like people don't understand the difference.
Okay, that's a very, very tricky question. And you hear on the news right now especially, oh, you can change every year. Well, you can change Advantage plans every single year because they don't ask medical questions. But if you wanted to go from a supplement, an Advantage plan to a supplement after 65 and a half, you have to medically qualify. So a lot of people say, well, I'm fine right now. I want to be on the zero premium plan. But then later on, if they get sick, that could be a big problem because they may not qualify to go back to original Medicare with a supplement. They're always told, oh, you can change, you can change. They just don't tell you what you can change to and what you may lose entirely.
And that is something that, again, when you sit down with people, you can explain that to them and say, here's the risk you will take if you make this move.
Yes, and we hear it all the time. We hear people say, oh, well, I didn't know that. They didn't tell me that little caveat. That little caveat means a lot.
And can mean a lot of money down the road.
Yes.
Absolutely. What I like about this is that you are truly looking at situations like you did with Linda and saving people money. I mean, talk about a no-lose situation for someone to come see you.
Right, and it doesn't cost anything to see us, so why would you not want to try to see if you can save something or see if there's a change locally that maybe your plan isn't accepted, or whatever. There's so many circumstances. It's just nice to have a good checkup.
It's personal. It has to be personal.
It does.
All right. Well, I know Linda came in thrilled about saving money, and you can too. Tell us quickly about the seminars across the area. Lots of different locations, lots of different dates.
We are in Inglewood, Venice, Sarasota, Lakewood Ranch. We're in Palmetto.
Oh, wow.
We're doing them all over the Sarasota, Manatee region.
And those are places you can come, get some basic questions answered, and no doubt then want to make an appointment for one-on-one service. All right, now's the time. Linda saved $1,000. I know you want to learn about Medicare open enrollment details by going to rbfretirementsolutions.com. We'll be right back.